Hello and welcome to another episode of Local Expert Interviews TV. I'm here today with Dr. Al-Falaki, a specialist periodontist, and our topic of conversation is how to find a good periodontist, or in fact, what is a periodontist? So, hello, Dr. Al-Falaki.
Hi.
Hi. So, yes, the first question. I mean, we've spoken to a lot of dentists on Local Expert Interviews TV, but you are the first periodontist. So, the first question that comes to mind is, what is a periodontist?
What indeed? And it's funny because when I see so many patients, they often say, I never even knew one of you actually even existed. So, a periodontist is someone who is a specialist in gum disease or in anything to do with gums. So we call it, periodontics is perio meaning around and dontics is teeth. So we deal with anything around teeth. So people with gum recession, people with gum diseases, people who need their gums reshaping a little bit or, to look a little bit better, or people who have gummy smiles, so improving cosmetics, but primarily most of it is gum disease. So that's what periodontics is, and what a periodontist is someone who's then done specialist training beyond being a dentist. So in my case, I spent 5 years doing further exams, diplomas, and then a 3-year specialist training program within a hospital setting where you become an expert in how to manage and treat these conditions. And you also, usually to do a specialist program, you're then involved in teaching and research and various other things as well. And then you come out and are able to call yourself a periodontist.
Oh, there we go. Fantastic. Can you, I still, again, going back to the point where we speak to quite a lot of dentists, what's the difference? How do I know as a consumer or a patient if I need to see a periodontist over a dentist?
Okay, so firstly, do you have any gum problems in the first place? And if you don't, then you don't need to see a periodontist. But having said that, you might not actually be aware of having gum problems. So a lot of the time, I think the first port of call through your dentist is a good idea. And a lot of the time, your dentist will then be able to diagnose whether or not you have gum disease. And they may do a little bit of treatment themselves or pass you on to their hygienist to try to manage the situation. Or they may think you're so severe that straight away they refer you on to a periodontist. And then we get other patients who stay within general practice or hygienists for a while. They're not quite able to stay on top of the problem or solve the problem, get rid of the gum disease, in which case they're referred at that stage. And having said that, we get a lot of patients who refer themselves. So they've read on the internet, or they're aware that they have gum problems, or they feel that despite seeing a hygienist regularly, they've still got what we call pockets or bleeding gums, in which case, to come and see a periodontist at that point is a good idea, because we don't want to sit on top of gum disease. We want to be able to sort it out, to get rid of any active disease. It's not something you can cure because it's what's known as a chronic condition. So you can never get rid of someone's susceptibility to the disease. So someone might be genetically susceptible, for example, so we can't manipulate the genes. But very importantly, we definitely want to get rid of having the active disease, which as a periodontist we're able to do. That's what we do all day, pretty much.
Okay, I'm sure a lot of the viewers out there have seen, adverts on telly or, billboards where, somebody pulls off a toothbrush with, a bit of blood on it, and, the message is not to avoid that and or ignore it even, and to go and see a specialist. Is there any further complications to one's health if someone does ignore those signs?
Yeah, absolutely. And it's like you say, there's that advert where someone has some blood coming out of their eye, and they say, you wouldn't ignore this, would you? But the number of patients I have who have had bleeding gums for years and they just ignore it because it doesn't usually hurt. But that's inflammation in the mouth, and there's increasing evidence now that inflammation in the mouth is a source of inflammation into the rest of the body. So we've got very sort of firm evidence now where gum disease is known to be linked as a risk factor for heart disease, for diabetes, for pregnant women who have gum disease. They're at greater risk of their babies coming up with low birth weights or being premature. And then there are other aspects of evidence, although perhaps not as strong, where we know now that gum disease may be linked to even various types of cancers. People are talking about Alzheimer's, kidney diseases, obesity, depression. It's not a good thing to have, which is why we want to get rid of the active disease. Really, really important to make that person healthy.
Yeah. Well, I mean, you've highlighted a list of serious conditions there that could all stem from, or all could be, you know, somebody could see them if you went and, you know, to see a periodontist. So, you know, if how do I know to go and see a periodontist, and more importantly, what three things should I look for?
Okay, so I mean, as we already said, your dentist might actually refer you, and sometimes a referral from your dentist is as good as anything, because that dentist has probably got established a working relationship with that specialist, which means they probably got a good idea, you know, how you're going to be treated when you go and see this specialist, right down from personality, friendliness, and the clinical results they actually are able to get for you. So that kind of dentist testimonial, that recommendation is important. But at the same time, you know, patient testimonials are important. So does that periodontist have a website, for example, with testimonials from other patients? Or do you have any friends? It's amazing when you start talking to people, you'll realize how many people have gum disease. You know, it's the commonest cause of tooth loss amongst people in the UK. It's a very common condition. So a lot of the time, if you start asking people, they may well have been to see a specialist and will be able to tell you about their experiences. So I think recommendations, be it dentists or other people, is a good thing. The other thing when you're actually looking for a periodontist is perhaps look to make sure that they're on the specialist list. I think that's important because that shows that they really have been through the required training. Because you can get people who might just have a master's degree, for example, and so there'll be a dentist with special interests. So they might not be they're not necessarily as highly qualified or experienced as someone who has done the full-blown specialist training. And the other thing I think is does that periodontist have something extra to add? So do they lecture in the university? Do they speak elsewhere? Do they teach? Do they do anything extra above and beyond what other periodontists might be doing, sort of new technology, something else, some other expertise within their existing specialty? So, you know, what else do they have about them that might add to your experience?
I think you know, that's a great question then. So what does Dr. Al-Falaki offer, you know, over and above in terms of technology, in terms of experience? Can you give us a little bit of insight into that?
I think I have good anti-wrinkle cream, so my patients think I'm ever so young, but I have been a periodontist for 14 years, so that gives me my wealth of experience, if you like. And you know, I go all around the UK and in fact all around the world lecturing as well. So I'm sort of taken quite and respected amongst my peers as well. So I think that gives me a bonus. In my actual clinic, which I have, we were the first specialists in the UK to use lasers within our practice, and I'm very much kind of the pioneer, and like I said, gradually we're getting more specialists to take this technology on board. We've now got a couple of hospitals who have taken this technology on board, which is great, so they're starting to do further research and build up the evidence base for where this particular technology could be beneficial. But where it's definitely beneficial, and I know it hugely appeals to patients, is there's very little need for us to carry out surgery on patients nowadays within our practice because of what we do with these lasers. Bone grafting surgery has almost become a thing of the past in our practice because what we're doing with the lasers, we're managing to get a lot of the bone to grow back, where previously we would have had to have done bone grafting. And the whole experience, the side effects you tend to get from gum disease, where people often get a lot of sensitivity that can last months, and sort of pain and discomfort after treatment. When we use these particular lasers in certain ways, all of the side effects from gum disease, which is things like recession, the sensitivity, the pain, all settle down much quicker. I mean, that's just a tiny, tiny little insight into what we're able to achieve with lasers, but it really is quite unique. And like I said, we're doing a lot of research that's showing the results are actually potentially more superior. And you know, we're gradually publishing papers and getting more and more periodontists on board to take on this technology because it really is revolutionary.
Wow, okay. So, I mean, the key things I took out of that, mainly from whether that be from a potential patient or a consumer, it was minimally invasive. You know,
absolutely, the key, for sure.
Yeah, I think, you know, you're talking about using and leveraging technology in order to make sure that the patient has what we call, you know, a pain-free experience. So.
Precisely.
Highlighting that, you know, if I or somebody else was to come into Al-Faperio Clinic, can you walk me through the experience that someone would get?
Yeah, I mean, usually when patients first come to see us, we spend about an hour with them, and more than half of that is probably talking. It's really important to ascertain from that patient what exactly is bothering them, or if they're even aware of having problems in the first place. Because when you treat a patient, you want to focus in on what their issues are. You know, not treat every person the same. You know, you're not treating a set of gums or a set of teeth. You're treating a person. So that's really important, to listen, pay attention, take that detailed history, you know, and have an understanding of why that patient is where they are at that point. You know, what has happened to get them to that state. And then we'll do a clinical examination, which is very detailed. We take an awful lot of measurements and x-rays if we need them. And then we put it all together to explain everything, give that patient an understanding of what exactly their condition is, why it's happened, how it can be treated, obviously how much it costs, what the side effects are, and what we hope to achieve for them short-term, medium-term, and long-term. You know, where they're going to end up and what we're hoping to do to help. And then it's also about building that reputation, because they're specialists, we're not their dentists, so it's really important that they maintain that relationship with their dentist as well. So we try our best to communicate with their dentist, even if the patient's referred themselves. Sometimes we're asked not to, in which case that's the patient's privilege. But otherwise, we sort of really try to adopt a team approach so that everybody's looking after that patient and empowering that patient to look after themselves as well.
Well, Dr. Falaki, I think that you've certainly given me an insight into, you know, periodontics. That you know, it's more than bleeding gums. I think, you know, that I think is really important. And I hope that to all the watchers out there, that, you know, if you do experience any kind of pain or problems with bleeding gums, then you take it seriously and go and speak to a dentist or a specialist in the field. So, Dr. Al-Falaki, is there anything else that you would like to add that we could share with the watchers?
I think so, actually, James. Just talking about the bleeding gums issue as well. So just quickly, maybe perhaps recap on what the signs of gum disease can be. So it may be bleeding gums. They may have bad taste, they may have bad smell, they may have recessions, the teeth may start to look longer, or gaps appearing between the teeth. Teeth may be starting to move position, or may get to the point where they're loose. Once you get to the pain stage, it's often very, very advanced, and that's the frustration. That's why a lot of people aren't even aware of having gum disease. because sometimes they may have one, two, or none of those symptoms, because it is often painless. So it's just, yeah, empowering and being aware. And then, of course, the other aspect of periodontics, as we said, is where we have the potential to reconstruct, so to do certain things with gums, to people who overbrush where their gums have receded, that we're able to, there are techniques out there that specialists can do to try to reconstruct those, and people who have gummy smiles. So it's become a bit of a cosmetic age in dentistry as well, and people are taking their appearance and the appearance of their teeth seriously. So the role of periodontist often comes into that field as well, where we can help.
Fantastic. Well, to all the viewers out there, thank you very much for listening and watching. I'm sure you've taken a lot of information from this, because I know I have. I want to say thank you once again to Dr. Al-Falaki of Al-Faperio Clinic. You can see her number on the screen now. So if you have any of those conditions that Dr. Al-Falaki talked about, then give her a call. You can see the number, and I'm sure her team or herself will be able to either advise you of what you could do next. So, Dr. Al-Falaki, once again, I want to say thank you for coming on.
You're very welcome. Pleasure.
And to all the viewers out there, thank you very much for watching, and we look forward to seeing you on the next episode of Local Expert Interviews TV. Thank you.